Hello friends, myself Dr. Sachin Mutha. Today we are going to study adrenergic drug classification. Always remember, the adrenergic drug acts on the sympathetic system, so it is also called as sympathomimetic drugs. Also remember, the adrenergic drugs are classified on the basis of two types. First on the basis of structure and second on the basis of the receptor. On the basis of structure, it acts on the catecholamine, and on the basis of receptor, it acts on the non-catecholamine. And the receptor type is again divided into alpha blocker and beta blocker. Today we are going to study the structure type of adrenergic drug. So whenever we study the classification of adrenergic drug, always remember a lady is standing in front of you wearing a hat or a cap and standing in front of you. So that lady, whenever she wears the hat or cap, it creates a pressure on the brain or the CNS. So the first type is pressure agonist. Second type is it creates a pressure on the brain or the head, so it is CNS stimulant. The third type, it acts on the nose, so it is nasal decongestant. The fourth type, it acts on the lung, so it is bronchodilator. Then it comes the heart, so it is cardiac stimulant. Then it comes the uterus of that lady, so it is uterine relaxant. And last but not the least, it is the anus, so it is anorectics. First type is pressure agonist. Always remember, for the pressure agonist, the mnemonic DENA PM. For D, it is dopamine. For E, it is ephedrine. For Na, it is noradrenaline. For P, it is phenylephrine. And for M, it is methamphetamine. Then it comes the CNS stimulant. For CNS stimulant, always remember the mnemonics MAD. M for methamphetamine, A for amphetamine, and for D, it is dexamphetamine. For the nasal decongestion, always you all know that is phenylephrine, xylomethalazoine, and oxymetazoline. For the bronchodilator, you all know salbutamol, terbutaline, formoterol. For the cardiac stimulant, you always know I am wearing a shirt with a 2 button, and in between the 2 button there is a heart. So always remember, in between the 2 button, so that is dobutamine, then it is isoprenaline, and then it is adrenaline. Always remember, for the pressure agonist there is a P, so there is dopamine, and here it is dobutamine. Then it comes the uterine relaxant. For the uterine relaxant, always remember the mnemonic Trishu. For T, it is terbutaline. R for ritodrine. For R is isosuprine, and for S, it is salbutamol. Then it comes the anorectics. For the anorectics, remember the vowel should be SAF. So SAF. For S, it is sibutramine. For A, it is amphetamine. And for F, it is fenfluramine. Hope you like this classification. For further classification and interesting mnemonics of the classification, please like and subscribe my channel for the last minute revision. Thank you.